join that flag salute, please. Wait till we come live here.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone. Welcome to Bourbon County Commission meeting. Okay.
Make a motion to approve the minutes from previous meeting.
Second.
Any discussion? All in favor? Aye.
Aye.
Aye. Jennifer?
Okay, I just have two applications for new culverts for approval. One is for Travis Schilling at 895 209th Terrace. The other is for Joshua Sharp, and that is on 255th Street, north of Osage Road.
So I'll make a motion we approve the new culvert for Travis Schilling and for Joshua Sharp.
Second.
Any discussion? All in favor? Aye.
Aye.
Thank you.
Thank you. Thank you. Mr. Will Wallace, please. How are you, Will?
Great. How you guys doing?
Good. Good, thank you.
I'm here today to present to you this hazard mitigation plan. It was approved back in 2019. This is a new one. The next one will be in 2026. And anyway, pass around everybody a copy of it. Pass these to them. One to the And if I could get you, Jim, to sign that at the bottom down there where it says, authorized representative of the jurisdiction. And then the clerk would sign point of contact name. And if you have any questions before you sign, naturally, go ahead. The bottom line is free money. If we were to have, the basic result is, if we were to have a disaster that brought in FEMA mitigation money, we would be qualified. Oh, you can't.
Red button on.
Oh.
Yep, it is.
Is it on? Okay, sorry about that. If we were to have any kind of disaster hit the county and FEMA brought in mitigation money, then we would be qualified for it. This is what does it. And there's a list you can see on the second page, all the incorporated towns and people like fire departments and so on and so forth, that I have sent this same forms to. Most of them already sent them back to me, no questions asked. Most everybody's been on board with it. But if you have any, if it's an incorporated town, then they are involved. But other than that, it's a good thing. It's, like I said, it's free money. And so it's just good all the way around.
Okay.
Okay? Just, I guess if you want, you.
I'd make a motion for, to allow Chairman Harris to sign the Regional Hazard Mitigation Plan Participation County Bourbon Jurisdiction, Bourbon County.
Second.
Any discussion? All in favor? Aye.
Aye.
Want this one signed?
Thank you, yes, sir.
There you
You got all
go.
three of them signed or just one?
No, just need you and then the
Right here,
clerk.
with signature?
Yeah, down at the bottom, down her name, title, signature. And then the clerk would be right under at the top, have her sign that, and then give me a copy of it.
Okay.
Other than that, appreciate your time.
Thank you. It's good to see you always, once in a
Yeah.
while.
Yeah,
Gotta make sure you're still here.
I'm still alive, still kicking around. Got more money coming in from that disaster.
Let me just share with you and the public, there's no such thing as free money.
No.
It's coming from somebody's
No,
pocket.
yeah, it's gonna come out of
Free to
somebody's
free to
pocket.
us.
It
But
might be free to
but
us.
if we can dip in,
Oh, yeah, we might as well get our share.
yeah, I mean,
Yeah.
like I said, it's be qualified money. How'd that sound?
There you go, that's better, thank you.
All right, thank you for your time.
And to make an addition to the agenda.
Okay, I'm not leaving early, you know that, but,
Yes.
yeah, you're not either, so.
No, I know.
Okay.
I need to, before Justin, if we could, plug in SEK Mental Health, they're here to present the budget.
Okay.
Make a motion to amend the agenda to add SEK Mental Health before the county councilor comment.
Second.
Any discussion? All in favor? Aye. You have the floor, gentlemen.
Appreciate it, thank you very much. Would you like,
Yes, please, thank you.
I'll pass copies of this around the table?
Sure.
Which would be our written request. I'm Nathan Fossen, the CEO of Southeast Kansas Mental Health. Dr. Wright is our Chief Operating Officer. We've both been with the organization for 20 or so years, 40 collectively, about that. It's our honor to present before you today our budget request for continued services, mental health services, in the amount of $91,800 of mill levy support. And this money more specifically goes to those that otherwise can't afford to pay. We, as a not-for-profit community mental health center, it's both our mission and our even statutory obligation, as is yours as a county, to provide services to the indigent or those that have inability to pay, that in fact need outpatient or inpatient mental health services. The types of services we provide are really quite an array of psychiatry, therapy, substance abuse, and then an expansive list of community-based services as well, such as case management, attendant care, respite services, parent support, and the like, supported employment, housing, and so forth. And what we would also want to address more pointedly is how we're undergoing a transformation in terms of the method of care we offer, as well as how we're funded. Historically, in the mid-90s, I'll be brief, I recognize we're in addition to your agenda, but historically we've been funded by way of fee-for-service for all Medicaid and other private health care services. And Medicaid specifically has woefully underfunded our services. And in the mid-90s, when mental health reform played out, there was a commitment from the state at that time to invest in community-based services while they were simultaneously shutting down inpatient facilities such as Topeka State Hospital. As we all know, even Osawatomie State Hospital beds have since decreased, placing more pressure, more need within the community to heighten the level of supports we offer. And with that was intended to come more money to support it. Well, that more money has not come, and in fact, it's declined over the last 20 years. Here within this most recent legislative session, it was approved for us as a community mental health center and the other 25 across the state to become what's called certified community behavioral health clinics. And with that, receive federal dollars at our cost level, rather than at our underfunded previous fee-for-service levels. So we've undergone a a costing exercise with the state to help determine how much in fact it does cost us to deliver psychiatry, therapy, and all of the array of services we offer. And have now just recently been approved our new cost rate. That's reassuring to us because it offers sustainability for the various services we offer, as well as providing us with opportunity to expand our services and enhance that which we already do. Enhance even in terms of our access. One thing we're now afforded is the ability, financial or otherwise, to hire on additional staff with trust that those positions can now be funded through our cost structure, which then helps everybody because we can now be more responsive to needs. If someone's calling in for their first time and wanting to get in as soon as possible, if we have more staff, we're more readily able to do that. So we're looking very forward to how that will benefit us into the future, and it already has benefited us in the present. What we're also looking at, specific to all of our 6 counties, and maybe more pertinent to Bourbon County, is the potential of upstarting a crisis intervention center. And these are centers, they're often referred to as 23-hour units whereby someone in crisis that may or may not need inpatient care can be dropped off, whether it be dropped off by law enforcement or self-referred or referred to us by primary care or the hospital, whereby we would have a facility 24/7 staffed with appropriate psychiatry, therapy, and support to assess their level of need, support them accordingly, develop a treatment plan that hopefully can allow them to go from that crisis center back into their home environment and continue working and functioning within their community. But if not, if at the end of that 23-hour assessment period, it's our belief that what they need is inpatient, then we coordinate the rest of those steps to help them get into, whether it be the state hospital or private hospitals alike. Now, how does this relate to Bourbon County? We've been in interaction with really a variety of healthcare entities along the way about how and if the hospital were ever to be reopened, how we might play a role therein. I've walked the halls and identified rooms within that would best suit our need. We would envision that of 5, maybe 10 beds that we could oversee and that would support that need. And should a healthcare system come in and own and operate, or operate, whether by lease or ownership alike, we would want to be a strong partner with them in terms of coordinating services and even perhaps supporting each other with recruitment and the like, staff recruitment and provider recruitment. I'm well familiar with the interests that the county has in that regard, and even Noble Health's efforts in that regard. Have they presented their recommendation or their feasibility report to the county yet?
We got it this morning.
Got it this morning? Okay. And they've already been here and presented? Or they just submitted the report?
I can get the report.
Okay. So I welcome in follow-up discussion with any one of you, all of you, about how that could look for us.
Okay.
Should there be some interest in that regard. Opening up a crisis center would be a tremendous investment on our behalf and commitment on our behalf, but it's one that we feel strong about because the need is absolutely there. If you were to talk with law enforcement locally and beyond the state at large, you would hear significant complaint about the delays they and we experience in getting individuals into private inpatient or state hospital.
If 100 plus people need beds every day in the state of Kansas, is that a number I keep hearing? At
Yeah.
least.
Yeah,
Yes.
yeah, they can't find them, yeah.
That can't, there's not, yeah.
Right, yeah, because both Larned and Osawatomie State Hospital are constantly at capacity.
Right.
Private hospitals have shut
Private
down.
hospitals have shut down, and so more of those people then are ended up in a state hospital, but yet the state of Kansas has not given into pressure that they need to add more beds. But the truth is they do. So who bears the weight of that? It's the local community. It's law enforcement setting out at the local hospital, mental health center setting out at the local hospital. These folks waiting for days for somebody to get into the care they need. So it's a really broken system. And this isn't necessarily the panacea, but it's certainly a help, right? If you at least had somewhere for some of those folks to go in the surrounding area. In rural Kansas, we always kind of come in last place when the state's voting on how to fund things, right? And so in Wyandotte County, in Johnson County, they've already had these facilities. We've not had those here. The state, of course, put their funding there first, where they already had more resources. So our hope is if this became a possibility, we could bring some of that further south, where it's probably needed just as much, because we have fewer resources all around. So that is really the goal with the crisis center.
In case in point, just yesterday I received a call from Chief Shelton inquiring what they and we together could do to help expedite the placement of an individual who's been at the hospital throughout this last weekend. First under the protective custody, and maybe all throughout under the oversight of protective custody of law enforcement, and then we spelled them off and by offering bedside support the remainder of the time. And I was calling this morning to get an update on the status of that patient and whether or not they've yet been admitted. Haven't learned the rest of that story. But the point is, people will now have to wait for a week and sometimes longer, but on average probably 3 days to get into a facility, all the while that we at the community level are supporting that need. And it's a significant strain, and a crisis intervention center could help lessen that burden and better support the need. And so it is something that we've been exploring as a possibility, even specific to the Fort Scott Hospital here.
Good. That's great news,
Other
that you're
things
looking
in-
at us, considering
in
us.
Bourbon County that I think is important for you to be aware of. So we have a therapist in the school that serves K through 12. We're wanting to add a second therapist in the school. Obviously, the school's been through a lot here in Fort Scott in the last year, and the need is great, so we want to expand that. We've also, within one preschool here in Fort Scott, started case management services, hope to connect a therapist to the preschool to do some of that early intervention for those kids that have been through trauma. We've also been speaking with the college. They're wanting us to bring a therapist on board out there. I think, mental health needs with COVID, with the economy, with so many things are just skyrocketing. And so we're trying to expand services. CCBHC is helping that. But county funding is also important. One of the things that, your budget's much smaller, so you have less to dole out for services than, say, Johnson County, right? And so Johnson County Mental Health Center, they get a lot more county funding for that. But really our cost of doing business isn't really that dramatically different. It is in terms of buildings, but we've got to compete for the same staff, and that's the difficulty. In the televideo world, we have to compete with the Johnson counties of the world in terms of trying to bring people here. So that's certainly comes at a financial burden to us, but one that we're very invested in because the need is so great. I mean, the things that have happened with our youth in the last couple of years have been just devastating when they don't have sort of that normal life. And so we see that need's there. We've already invested heavily. We have probably the most robust school-based programming of any mental health center, but we also see it's not enough. So we want to build that up, and Fort Scott's certainly one area that we're wanting to do that in.
Any questions or suggestions for us?
Do you have a card, Nathan? Because it's fine, right?
Yeah, let me hear.
I can forward you this information to you.
Okay.
And I'll circle my cell.
Okay, that's
there as
what I
well. So my cell number is on this letter, and please reach out to me at any time. Even if you're just wanting to dialogue or inquire about our services or brainstorm about what and how we could better serve. I welcome both the critical feedback as well as the forward thinking about how we could better serve. So
Thank you.
So you're saying in Kansas, is finally starting to step up and address mental health again.
Yes.
A little bit.
You know,
By way of
2004, 2005, I saw many years go away.
yeah.
And that was the start of the big decline of mental health in Kansas.
Yep, absolutely. And, you know, the state of Kansas has acknowledged along the way that they've not fulfilled their promise to appropriately fund community mental health. And yet they, over the last 20 years, just continue to whittle away at our budget that subsidizes all we do. But here, in this last year, legislatively, they approved the certified community behavioral health clinic program, which then injects the level of funding into our system that we need.
And we're one of the first 6 they certified in May, so it's good to be on the forefront of that. But you're right, Menninger's changed mental health in Kansas when they left, and the state had lots of promises or ideas of how they were gonna reinvest and continue to have Kansas be a leader, but that never happened.
Never
So
happened.
For the last 20 years, it's been a decline in funding, and so.
Well, like you said, your funding sources went away too,
Yeah.
Yeah.
or decreased.
So, and you're in Allen, Neosho, Bourbon, Crawford, Cherokee.
No, not
No.
Crawford, Cherokee.
No.
You were doing really well until you
You
hit
were,
Crawford.
so Lynn County,
Maybe
Boone
someday.
County,
Okay.
Anderson, Woodson, Allen, Neosho.
Okay, okay,
Yep.
okay.
Very good, thank you.
All right,
Thanks.
thank you.
Thanks, guys. You have employees that speak extremely highly of you and your organization, by the way. I have a couple of very good friends that work for you, so.
All right,
Oh, great.
nice to hear, appreciate that.
Justin Meeks.
Real fast.
Real
Just wanna
fast.
Update you on a couple of things real quick. I talked to the title company, then we had, the contract was presented, we had, Commissioner Harris already to sign that, but they did raise the rate from 85 to 110 per parcel. So I wanted to give you guys that heads up before Commissioner Harris signed that. Obviously, everything's increasing. That makes an interesting, problem with some of the Hidden Valley lots, in my opinion, but outside of that, that's what the rate was. So if everything's good with that, Commissioner Harris can sign that this week sometime. So just a quick update.
Wait, we won't have a choice, do we?
Not really. We could, I mean, yes, we have a choice, but I think just time, speed, that type of stuff. We could find someone to go through and kind of do the title searches, but it's not worth it.
Okay, thank you.
Yep.
Is that it?
That's it for me.
Ah, that's
We
easy.
got an executive session we'll go into.
Susan? Morning.
Good morning.
I have a couple of things. Financials, I kind of added to them, and I'm hoping to expand on this even a little bit more. I give you a 5-year look back of sales tax, and then whatever the current year is versus the previous year to show if we're over or under what we've brought in for sales tax in the previous year. So currently, we're looking pretty good. We're up $103,000 as of the end of April. Alcohol is another one that we're starting to see some money come through on those funds, and I would assume that's because of the addition out there at the south end of town. But the sales tax is the biggest one, and then the second sheet is other major sources of revenue. So I put in culvert sales, landfill receipts, chemical sales, sewer district, EMS, and the medical building, so that we can kind of track this month by month to make sure that we're hitting the targets that we need to. It's more as a tool. I am concerned with EMS and what we brought in last year, so I'm going to reach out to Omni and see if I can get some reporting from them. Is there any other revenues that you would like to see presented each month? No?
So,
Not familiar.
Yeah, go ahead.
2020, 880, 884.
Yeah,
Only six,
yeah.
that's Okay.
That's concerning.
That's- Yeah, that would be very much so.
And that's, yeah.
Okay, just making sure I read that. I'm
Yes,
reading
you
that right.
did. And I went back through and validated all the bank recs to make sure that the funding got into the correct fund. And Jennifer spent several days on that. We also validated the credit card statements and everything.
I mean, just, yeah, in healthcare, this doesn't make a whole lot of sense, actually. The months that, there's certain months where you're going to make more money in healthcare,
Right,
and this is kind of odd. So,
yeah,
okay.
yep. Any other questions on financials, anyway?
Thank you. No.
We'll try to continue to meet our obligations every month. And we had the audit last week. There were a few items that were concerns. I'll let Terry talk those over when he gets here. Nothing, no big surprises. So that's encouraging. But we did know that there would be a few violations, so. I just need an executive session that includes myself, the commissioners, Justin, and Shane for non-elected personnel to discuss contracts and performance.
For how long?
We better do 15 minutes.
I would do 20 minutes with job assignments too.
Okay.
As part of that.
Before we go in there for 20 minutes.
Yeah.
Too much calls.
We're gonna take
There you go.
a short break before we do that. I seen your daughter on Facebook, it's with the dad.
Uh-huh.
That's you. Gosh,
Don't say that, because she's a kid.
unbelievable. I looked at that, and I looked again.
looked like me.
Oh, gosh, yes.
She does.
For sure.
Oh, yeah.
Oh, yeah.
Oh, yeah, my
Any
goodness.
picture you put, yeah, any picture you put on Facebook, I'm great.
Yeah. What's wrong with her like being on the agenda, just give us updates? Don't know. I'll ask him.
I'm sorry?
I'll ask Rob if he'd ever like to be on the agenda, just give us updates. I mean, it shows up, he never talks. Rob,
Well, it's got something to say, maybe we'll get on the agenda.
maybe, I hope so, yeah.
I'm sure he will.
Larry Gaither calling at the roof. At the constant, which is fine. It's just young.
Yeah.
We want to spend. You ready?
We're ready. If you're ready to make the motion.
Make a motion to go into executive session, KSA 75-4319B1 to discuss personal matters of individual non-elected personnel to protect their privacy, job assignment, performance, be 3 commissioners, Susan Bancroft, Justin Meek, Shane Walker. 20 minutes, we return here at 9:48.
Second.
Any discussion? All in favor? Aye.
Aye.
What's that?
How to clean those fish?
Oh, yeah. Oh, yeah. Yeah.
If you ever get too many, remember where I live, right? We've been going so long. I don't know, they go that way, Bill's-
Lynn went that way. I don't know where everybody else went. I know Lynn went that way.
You're supposed to keep track of it.
I don't know. Yeah, right. You go right ahead. I'll say.
Not me.
Okay, sir.
Make a motion to resume normal session, 9:48. No action on this one.
Second.
Any discussion? All in favor? Aye.
Aye.
Make a motion to go executive session, KSA 75-4319B1, to discuss personal matters of individual non-elected personnel to protect their privacy, assignments.
Three
assignments.
commissioners.
Just 3 commissioners? 3 commissioners for 10 minutes, be 9:59.
Second.
All in favor? Aye.
Aye.
motion to resume normal session, and we will have some action.
Second.
From the executive sessions.
Any discussion? All in favor? Aye.
Aye.
And I don't remember what it was. Contracts.
Yeah, it was just to approve the contracts.
And a replacement position.
For two
Susan
positions.
You like to tell us how you like that worded?
You have two contracts that you need to approve.
Oh,
Make motions on, yes.
yeah, I need permission to sign these contracts.
Make a motion to allow Chairman Harris to sign the Chief Information Officer contract and
Public Works Director.
Director's contract.
Second.
Any discussion? All in favor? Aye.
Aye. Motion carries. I'm gonna go to the restroom if you don't mind.
What was the other? We had one more. We had one
I'd
more.
recommend it.
What's that?
We had one more.
One
The
more-
other one
make
is
one more motion.
to go out for a replacement at the hospital.
Oh, this is a backfill, so.
Yeah,
Yeah.
backfill.
Do we need to make a motion for that? No.
Okay.
Okay. Now,
5-minute break.
coffee break.
Coffee break.
You should have gone when we had a break before.
Body's gonna work that.
Give that to you. How you, Matt?
Pretty good.
Good.
Alive, nobody shooting at me.
That's important. Yeah, I'm getting too old to run. I just had to fall down. Couldn't outrun them anyway, so.
See, that scene from Patton makes a whole lot more sense now. When he goes out there and gets mad and says this is enough and starts shooting at the pilot with his plane. Same deal. He's too old to run. He's like, this is enough of this.
Yeah. It seemed like the last several weeks, month, every time I turn on the television, there's been a shooting somewhere. So, it's scary.
Well, it's funny. When I lived up at Leavenworth, there for a while, there were reportings every night on the news about how many people were shot. Then all of a sudden it went away. They stopped reporting.
Top report, yeah. Okay, ready to move forward? Shane, are you done, Shane, or?
Shane.
You,
Yeah, I just,
was you done? Okay,
yeah, we don't have anything.
okay, very good, thank you. Public comment.
Come on, Clint, you were looking over those financials awful hard.
I do have a
Going once.
comment, but it's nothing. Our number one concern as far as growing this county is going to be housing, and you're gonna find that on any survey. And the only thing I'm bringing up to the commissioners at this point in time, and I keep kind of track of what's going on in the state, for developers, for our size, they're given money to develop like apartments and stuff. And we need to keep track of that and make sure that they're aware of that. I'm sure they will be, but hopefully that will encourage housing here in Bourbon County. That's coming, and that's not federal dollars, that's state dollars, so I didn't know if you all were aware of that, but
I
just
am
let you
some
know.
of it, and that's something we probably need to get Rob and someone involved to
That's what I was thinking, Rob.
hopefully chase some of those dollars. We certainly got a housing problem.
Yeah,
And it's hard for, I know we've discussed it in great detail here, but it's all about that money.
oh yeah,
A lot of investment that the county just can't hardly afford to get involved. We want to get involved
right.
with some incentives or something, but for us to go out and buy 50 acres and encourage development, is just cost prohibiting for us. I mean, we don't have the money. So.
Right.
Is there not, and you may not be aware, but
Thank you.
is there not any even, city folk wanted to go build a house somewhere that got some acreage? There's not anything even there that is helpful?
So we do the NRP.
Okay.
Yeah.
And does that
Pretty
apply in the
substantial.
county as well as, oh? Okay.
We're
Yes.
Yeah,
Our
they're separate.
NRP's been in effect for a number of years now. City let theirs expire,
Yes.
and they're in the process of renewing it. But yes,
That's really helpful. My son
Very
built
helpful.
on, and that really helped him.
the problem being is that a lot of people go out and build without really knowing about the NRP.
Yeah. Any other public comments? Commission comment. Bill, did you have something? I don't see it. Okay, all right.
Well, there's the feasibility study. All 2,000 pages. No, not really. But we do have, I don't know how we want to, the city needs some of these, but anyway. You guys want to look at that? That is the, Justin.
Rob, give one.
I want Justin out here. So, I don't know how we're gonna disseminate this information. We do not have it on the jump drive, it's strictly in paper form at this point. That is the Bourbon County Hospital Feasibility Assessment. This is the Bourbon County Hospital Building Assessment, which as you can see is, I don't even know how many pages it is, but it's big. I got this morning at 7:15.
Would it be possible
There are, I
to
will,
have one available? I mean, I know the clerk's office will have one on file, but like if I wanted to come up and sit in this office and look at it, and like check it out, I mean, not leave the building with it.
I think there, Justin, in my opinion, Justin will need to look through this. I know for sure there is some documents that I have not gotten yet that are absolutely proprietary, Terry, that we can't release at this time. My opinion, this stuff, and this was the opinion of Noble Health too, that this stuff is pretty standard stuff. If you're willing to spend a lot of money, you could probably find this information out, like they did. But, I think we have if a person wants a paper copy, my understanding, we charge 35 cents a piece of paper. Mm-hmm. I think all in all, this is over, with the other proprietary stuff that I think probably will be released eventually, truthfully, I think. But I mean, a person's gonna spend $500 if they want paper copy, pretty easy with all the papers. I think they are gonna provide us an electronic version. Don't have that yet. They will be delivering it actually in the next day or two. I think they literally just finished this like Friday or something. I think these were hot off the press like last night. So, but anyway, there it is. Lots and lots and lots of information to go through. They do have I think I think there was a possible plan for them to present. That's not going to work for some health reasons for one of them. But anyway, there are recommendations in here. They do have recommendations. to what they think we should do.
Can those be oh, that's in there.
They're in here. Let me find, sustainable, yeah, I mean, there's, like 20 different recommendations. You know, I mean, they're pretty generalized. You know, I think you get further into it, then the meat of it is more. I mean, these are really, they're on page 13. You know, it's to you know, to potential evaluate a PPS or an REH, which is a rural emergency hospital legislation that will be January of 2023. We are not part of that legislation at this point. We would have to apply for an exception to be part of that. We as a county don't necessarily apply for that. I don't think the operator has to, so Via Christi or some other entity with the county. But it talks about the collaborations of different entities is important. A behavioral health unit, renovate the hospital for a behavioral health unit.
And
Go ahead.
just that portion there, is that a collaboration with the gentleman that were here, the entity that was here this morning, or?
I mean,
Or can
I'm not sure
just
that.
don't know yet. I mean,
I'm not sure. I mean, in my opinion, they wouldn't be able to. They would collaborate with another operator, because they're funded differently than a private payer type system. So, if via, and that's a bad example. If XYZ Incorporated healthcare system came in, then they would collaborate with Nathan. I mean, that's what I would like to see.
Sustainability, that's the way
But
it has to work.
yeah. I don't think, because they're more of a 23-hour hold type thing, then there would be another operator behind them that could be a long-term hold. And then there would be another operator in the front running the hospital side of things, the emergency room side of things. So that's where you know, if you look through a lot of this, I think collaboration amongst multiple entities is the answer. Let's see. It shows that you know, I mean, there's some really disturbing stuff in here, and as far as the health of Southeast Kansas, the lack of health in South. I don't mean health care. I mean just the healthiness of people. You know, the contracting with local businesses, that's on here. To use the services, to try to get people on Medicare, Medicaid. I know that Via Christi and CHC do that actually, but there's no reason we can't assist them in that. Possible nonprofit to own the building.
So nothing other than the brief that they did a few months ago, realistically?
No, there's more than that. But I mean, that's what the recommendations haven't changed that much. No. You know, the building is potentially worth quite a bit of money. The borrowing potential against it, and so you could, you know, somebody could go in and revamp it fairly easy, or they'd get the money to do that fairly easy if they can find tenants. But I don't know. Let me go through some pages that I just marked and see if I can. The biggest one is, I mean, what's the You know, the fact that we're 2 times as likely to die here than any other county in Kansas from heart disease. Obesity is, I mean, it just goes on and on. Cancer is about average across the state, national. Heart disease is the biggest one, probably. And
Do they go in, when you talk about heart disease, obviously it's a problem, but do they go into how they would address that, or is that not part of what? Oh, okay, okay.
Yeah. We are 2 times the, so heart attack death rate in Bourbon County is 98 per 100,000. That's 2 times the rest of the state of Kansas. Yeah, they do. You know, it's just more specializations. You know, we can't, you know, be great to have a fully functioning heart hospital with a heart cath lab and everything else. Obviously, we can't do that. But there's no reason we can't have some specialists, which Via Christi actually has a cardiovascular specialist up here. So, I mean, they're working on that, you know, but I think we need more. This, you know, if nothing else, this study shows that we certainly can have more robust health care. Anyway, there's a lot. It's just a lot. But yeah, there's some of that stuff in it, and it's just, I wrote some of these pages down to talk about that, but it's just so much information.
So what's next? What happens next? We have a study.
You know, here's one that was interesting, and they talked about, you know, I wish Mr. Fossen was here, but the mental health side of it is significant. Of course, we all know that, I think, and the increased in deaths from suicide since COVID has, and this is across southeast Kansas and the state of Kansas, but has just drastically increased. Let's see, that just shows the need of some type of you know, of us helping Mr. Fossen and maybe trying to do something else.
Do they address the need for a drug rehab facility of any sort, or, yeah?
And I don't mean to interrupt, Commissioner, but I think on page, I mean, obviously, I think just going through, and I need to look at it just a little bit more closely, but the Bourbon County Hospital feasibility assessment, just going through the index and looking through, there is a legal opinion, but it's a legal opinion that we want out. It talks about the types of licensing that we've discussed, but it defines it from Polsconelli Law Firm. Page 134 is what Ann's talking about with regards to geriatric behavioral health and behavioral health. And for us, outside looking in, I mean, we didn't know what healthcare looked like. And so this gives us a really good idea, in my opinion, what healthcare looks like if we think outside of the box. And so you have geriatric behavioral health at 25 beds, and going through, I think these are pretty conservative numbers, there's a potential of a net profit of 4.4 million. And if you look at behavioral health with 10 beds, you're looking at a profit of 1.1.
That's the SIA state program.
Right, yeah, I understand. So I'm just saying that this has got good stuff in it. I don't foresee anything in here that's really gonna be confidential. I mean, I looked at the index and read the parts that potentially could have some conflicts, but I don't see anything that, now this is gonna take a while. I gotta go through, this is gonna be probably 2 weeks. I'll take this with me on vacation and read it before I go to bed. So, I mean, it's gonna take a while, because there's some things in here that, so, I mean, there's some safety and security issues that I'm worried about in here.
Well, the other document that I'll have access to is the same. I mean, so definitely, this one I thought though would.
Yeah, this one I don't see anything. This one actually, and this is where all, this is the meat and potatoes. This is what I think if I was in your guys' position, this is what I'd want to read. This is really a assessment of the building. It's got some interesting things about costs and alarm systems and fire, things like that, but some of this we don't want out in the public because people could do some things to our building, so. But I'm not quite sure yet. I gotta go through this, but this one I think is absolutely gonna be discoverable. And Commissioner Beth is correct, it's 35 cents a page. And it's,
I'd wait for the thumb drive.
yep. It's 186 pages long, so times two.
The question was, is there any reason why they can't come up here and review it on site?
On site, no. The only thing I would have is a place to where, you know, obviously most people don't want their offices sitting there. There's some security issues with your drawers or whatever, but, because this is gonna take a while. They probably want to be here for an hour or two.
Oh, I think you could spend a week with it.
Or longer than that, yeah. I mean, there's a lot of
Well,
data in
there's
this.
only
Well, I
about an
mean,
hour or
the-
two, I would be able to, I mean, and my
The
brain would
other,
be done.
the other side of it is the appendix that goes with this, is over, I think, 600 or 700 pages. But it absolutely has some proprietary information in it, so.
Well, that's gonna be the thing that probably, I mean, this information you could get if you spend a lot of money, right? I mean,
Yes.
am I making that assumption correctly? I mean, I could spend,
Yeah.
I mean, so, to me, even those appendixes probably are gonna be discoverable under Kansas Open Records Act, but we still need to go, I need to go through them probably.
Well, I think you should go through them, that's
Okay.
all. Just make
So
sure.
that stuff's gonna have to be redacted.
It's a lot of reading. Thanks, guys.
I don't think there's a thing in this one. Which I don't know why anybody just and truthfully would want the other pieces, really. I mean, I think it's all in here, it's just condensed. The other is
Nuts and bolts.
kind of nuts and bolts stuff, and I mean, I don't know. I mean, an operator may want some of the other stuff. Somebody that's thinking about reopening the building is probably gonna want, obviously they're gonna want some of the bids and different things that we can't release.
Right, and it talks about, in the feasibility assessment, it does talk about the building assessment in here. I mean, so this is really
Yeah.
this is a more finite detail of what's in the actual,
Exactly.
right. And to me, even this talks about generalities. I mean, this is the thing that absolutely everybody's gonna want. I don't
That's
think
what I
anybody's,
think. I mean, I don't see very many people going through the other 1,500 pages
no.
of,
And I would say probably 8 or 99% of it is gonna be discoverable under Cora.
probably,
Yep.
probably.
All right.
So I asked what's next with all of this? What, do we know yet? Who takes the next step, or, I don't know.
Well, I mean, since Noble is gone, basically, I don't think they exist anymore. We are actively looking for, partners,
Okay, wait.
whether that's via Christie or whoever, we are actively searching for an operator. And, I mean, so there's a recommendation in here, and I agree with this recommendation, to put out an RFQ or an RFP, a request for proposal, request for quotes, to do something in that building.
So the county is no longer in talks with Noble Health to bring services to that building. Okay, and can I ask, when did you all find that out? Can I ask, or
I mean, I think I stated that a couple weeks ago.
oh, did you?
Yeah,
Oh, I missed it, sorry.
yeah.
So, going forward then,
Do what? Yeah. So anyway, it's been a few weeks. Rob was he's sitting there saying, yeah.
was I not here?
You've been gone a couple, 2 or 3 weeks.
I
was here, that's what they said.
Did I say that, Clint? I mean, I think I did.
When they did their presentation,
say
they
that.
said that?
Yes.
Dang,
Yeah.
that went right over my head. Wow.
They said it without saying it.
Okay.
And then I
Okay.
restated it,
Oh, gosh.
and I know it's been in the paper.
Oh, yeah.
Oh, I don't get the paper.
And on the, I mean,
So, now that we have this information, that puts us in a more favorable position to do exactly what you said, to if another entity calls you up or calls the county, I don't know how they do that, call Jim, or what do they do?
We call them.
You call them, so you now
We are actively
are.
trying
and
to
like
fill
you
that building.
would send, what, this information to say 4 or 5 entities or whatever,
Well, some of them may not want it. You know, they'd be like,
Oh,
thanks,
okay.
but no thanks.
okay, all right.
But, you know, we're not developers. I go back to the same thing I've said a number of times. I think, well, a long time ago, is, and Jim and Lynn may not agree with me, but we should not be building owners. We have no business running a hospital. So, I mean, you know, I think it's twofold, and I believe that's in here somewhere, that we request a developer and then an operator, or it could be the same thing. That could be the same, or it could be two separate, meaning a healthcare system, meaning like Via Christi or SEK Mental Health or whoever. Plus then you know, if they are able to, you know, set the building up how they want, great. If not, then we get a developer to come in there and help with, okay, you need a wall here, you need to, you know, tear this part of the building down, whatever it may be. Or, you know what, shouldn't do anything. You know, I mean.
I don't mean to interrupt, but there is proprietary information in the building, not that one, not the feasibility study, but 9.4 and 9.5 need to be proprietary.
I thought there was.
Yeah, so that, we don't want anybody, we need to pull out.
Just take them.
I just need to, why don't we
Just
just keep those until we have a chance to go through them and.
It's gonna be 2 weeks.
And redact what we need to redact.
Yeah, and I'll get with Ashley's office and go through and mark out with a marker what the information is proprietary, but 9.4 and 9.5 are proprietary for sure. It'd could cost the taxpayers money actually, if we decided to bid it out.
Okay.
I want, are you done, Clifton?
Unless Anna has more questions. I mean, I think, I guess it'd be up to all three of us, but I think, I mean, my opinion is to follow those recommendations and to go out for bids on, you know, and I mean, there's people, I mean, Rob and myself, I mean, we're in contact with other healthcare systems. I have been for 2 years, so.
I want one more executive session. I know I've been a pain, but talk about non-elected personnel for 10 minutes, 3 commissioners and Justin.
For how long?
10 minutes?
10 minutes.
You want me to do it? Or are you gonna do it?
Go ahead.
You
I
read
don't
it?
care. Go ahead. You're good at it. I'll do it.
I've like
Put my
memorized it
glasses on and
now.
read it.
Make an motion for executive session, KSA 754319B1, to discuss personal matters of individual non-elected personnel to protect their privacy. 3 commissioners, County Councilor Meeks, be for 10 minutes. We return here at 10:38 for job performance, or?
Yes.
Yeah, okay.
Second.
All in favor? Aye. worked out much better for me.
Yeah. Make a motion to resume normal session, no action.
Second.
All in favor? Aye.
Aye.
Okay, guys, one more, I'm sorry, I'm doing real quick in a moment, but Garland meeting, and can you clarify again, just so that we're sure, on this study, the smaller one, if I wanna come up and get it from Doretta, the clerk's office or whatever, and I can sit in here and look at it, that's okay to do?
Yep.
Okay, all right. And then Garland meeting.
15 minutes at a while.
$1 a minute. Okay. Two things. I'd like to congratulate you, 234, on hiring their superintendent last night. I think that was an excellent choice. I know the gentleman, so good job. And our next meeting is at Garland, next Tuesday at 6 p.m. at the Garland Community Center, right downtown Garland. I encourage everyone to join us there, so.
I think it's the only building left, isn't it?
Don't- Yeah. It's the new building in Garland. Easy
Can't
to
miss it.
identify.
Can't miss it.
Anything else, Clifton?
I don't need anything.
Glenn, anything else? Entertain motion to adjourn.
I move we adjourn.
Second?
sorry.
Okay. All in favor? Aye.
There's a box, Brian.
Going lunch?
You can have it.
Lunch today? Thought we'd run over.